Okay. So can you guys tell me that what is anemia, and can you just tell me what are the common signs and symptoms that occur with anemia? Okay, perfect. Reduction in red blood cells. Okay, if a person has reduction in red blood cell, so what it means? It means that you cannot transfer or you cannot transport the oxygen well, right? If you aren't giving proper supply of oxygen to our tissues, so what happens as a result? Can I say that I'm going to see weakness, I'm going to see fatigue, I'll be seeing some dyspnea in that individual, right?
Yes.
Okay, so we are going to see. Okay,
Conjunctival.
guys. Hello. Hello. Yes.
Conjunctival
Yes. So,
style.
Sorry, I can't get you. What are you saying, Dr. Nelson? Okay,
Yes.
okay. Yes. Perfect. So we are going to see weakness, we are going to see fatigue, and along with that, we are going to see dyspnea. Okay, we are going to see conjunctival pallor or pale conjunctiva and skin. Why? Yes. Yes, if you have less red blood cells, it means the red color is basically lost. So simply you can think of, you are going to see the mucosa being affected, and you are going to see pale mucosal surfaces. Okay, it can also cause angina and some coronary artery diseases. Why? The idea is same. If you are transporting the oxygen less, it means you have less oxygen delivery to heart as well. It means it can exacerbate the signs and symptoms, the signs and symptoms of angina, right?
Yes.
Hello. Okay, let me just give you no, an, a simple concept how to see whether this type of anemia comes in microcytic, macrocytic, or. Okay, just give me a second. Okay, so first of all, let's discuss microcytic anemia. Okay, so what is the basic hallmark for microcytic anemia? What happens in microcytic anemia, guys?
size of cell decreases.
Size?
Okay, so size is decreased.
Yes.
So for the size, we basically use a term that is MCV,
MCV
mean
is less.
corpuscular volume. So MCV would be less than 80, right? Okay. So whenever the MCV is less than 80, so I would say it's a microcytic anemia. So you can, okay, why the MCV is going to be less than 80? Okay, can you guys tell me the hemoglobin? Hemoglobin is made up of heme plus globin, right?
Yes.
Okay, heme is furtherly made up of iron. Hello?
Yes.
And
Can you guys plus
protoporphyrin.
protoporphyrin? Please participate, okay? Like, okay, protoporphyrin plus globin. So the idea is simple. For example, if we do not have enough supply of iron, it means you cannot form heme well. It means you cannot form hemoglobin well, right? So it means that inside the red blood cell, the content is going to be less. You know, hemoglobin is one of the constituent of your red blood cell, right? Okay, if the hemoglobin is less, so what would this cell do? This cell would just undergo an extra division. In order to compact all of the constituent, they are going to undergo an extra division. Okay, like it's simple. For example, if this is my, let's suppose red blood cell, and if I am having less amount of hemoglobin here, so what would it do? It would just divide one extra, it would just undergo extra division in order to have compact. Okay, like this hemoglobin would be sufficient for that small red blood cell, right? And this part, little part, would be sufficient for that. So what's the main idea? If you have less constituent of your hemoglobin, so they would undergo an extra division. Simple. It means whenever I have less iron, I would form less hemoglobin, heme, less hemoglobin. If I have less hemoglobin, what happens? You are going to see an extra division. If I am dividing my red blood cell extra, it means the size would be small. If the size is small, so it would come under microcytic anemia, right?
Yes.
Okay. For example, if I have certain pathologies which are associated with development of protoporphyrin. One of which is, if you guys remember, lead toxicity. So how the protoporphyrin is basically made? You have ALA simply. ALA is going, okay, succinyl coenzyme A is going to become ALA, which we'll be discussing furtherly. ALA is going to be converted ultimately into protoporphyrin. Okay, protobilinogen, and after that it's going to become, okay, so we have certain enzyme that is B6 is going to act as a cofactor in that, or D or ELA synthase, and in the end you have ferrochelatase. So what does the lead do? Lead just inhibit the activity of these enzyme. If I'm inhibiting the activities of this enzyme, it means what happens? My protoporphyrin won't be made properly if I'm inhibiting those enzymes, right? So what happens? I'm going to see less level of protoporphyrin. If I have less level of protoporphyrin, what happens? The heme is going to be less in concentration. If the heme is less, hemoglobin would be less. If the hemoglobin is less, it means the cell have to undergo an extra division. So it would be microcytic anemia. So lead poisoning is going to lead to microcytic anemia, right?
Yes.
Iron deficiency is going to lead to microcytic anemia, right?
Yes.
Yes.
Okay, if we have some problems with the globin chains, for example, in thalassemia, alpha beta thalassemia, it means the chains aren't made well. It means the globin isn't made well. It means hemoglobin is less, or it isn't made in sufficient amounts. It means the cell have to undergo an extra division. So it would also be your microcytic anemia, right?
Hmm.
Yes.
Now you guys know. If I tell you we have a person, he have severe bleeding, or for example, if you have a lady due to menstrual cycles, she just lost greater amount of blood. Okay, if you are losing blood, it means you are losing iron. If you are losing iron, which kind of anemia are we going to see? Micro or
Iron
macro?
deficiency. Micro iron
Normocystic.
deficiency.
Okay,
Normocystic.
normocytic. Okay, let's discuss that as well. Okay, for example, if you have a chronic disease, you have the iron, but you can't. Okay, for example, you know this iron is basically stored inside your macrophages and your liver, right?
Yes.
Okay, if I have sufficient amount of iron, but I am not letting this iron to come into my blood and participate in this process. Hello?
Yes.
Okay, if I'm not letting this iron to come into blood and participate in the formation of hemoglobin, again, you won't be seeing enough formation of hemoglobin, again, microcytic anemia. So what is this condition called if I am not letting the iron to come out?
Anemia of chronic
Anemia
disease.
chronic disease.
Perfect. Anemia of chronic disease, hepcidin is going to sequester all of the iron inside. Okay. For example, if I have a type of anemia that is sideroblastic anemia, and I am just won't letting this process to happen. Again, we are going to see which kind of anemia. Microcytic, right?
Micro.
Okay, if I have some problem with globin genes, that is thalassemia. Again, it's microcytic anemia.
Yes.
Okay, so now let's discuss little details of all of these anemias. So, okay, can you just tell me the normal range of hemoglobin in female? It's considered
12 to
as
14. 12 to 14.
12 to 14. Okay, so the lower limit is 12. Perfect. In the male, what's the lower limit?
Of 13 to 15.
Okay, 13. So 13 is the, okay. Okay, so now let's discuss iron deficiency anemia. Okay, so what happens in iron deficiency anemia? You guys know iron isn't there. It means you won't be forming what? Hemoglobin. If the hemoglobin isn't formed, it means, okay. So in the MCQs, what would be basically the history? The most common history in iron deficiency anemia, it would be a female who have undergone menstrual cycles and she lost some amount of blood. So it would
80
indicate
ml.
iron is losing, right? Okay. So secondly, how the iron is transported inside your body. Okay, can you just tell me the site where iron is reabsorbed inside the GIT?
Ilium.
Ileum or duodenum?
Duodenum.
Okay, it is duodenum. Perfect. So Okay, so the iron, for example, there are certain stages of iron transfer. For example, we know the iron is transported inside the blood, and what's the name of that molecule or
Transferrin.
Transferrin.
that? Okay, perfect. If it transferring, if it is transferring, it means it's transferring, right?
Mm.
Okay, so once the iron is transferred, sometime it is stored as well. Stored in, as we have already discussed, in the macrophages and inside the liver, right? So the stored form is basically your, what's the name for that?
Ferritin. Ferritin.
Okay, ferritin. Perfect. Okay, so ferritin is basically the, okay. So okay, for example, if you want to measure the total, okay, what's the percent saturation? Okay, let's discuss. Okay, remember guys, as we have discussed that the ferritin is your storage form, right? And your transferrin is basically your present in your blood, that is basically transferring your iron, right?
Yes.
Okay, so for example, if we have increased ferritin, in certain condition we have increased ferritin, so what would happen to the transfer in level inside your blood?
Decrease.
Decrease.
Decreases, like it makes sense. For example, if I have good reservoirs of ferritin, it means I do not need any transferring molecule to bring more iron, right? So they always go in opposite to one another, or they are inversely proportional. You guys must know that. Okay, it's very high. You are going to see certain MCQs, they'll be asking you that, for example, we have discussed that in certain condition ferritin is increased as anemia of chronic disease. So what happens to the TIBC, which is total iron binding capacity, which is dependent upon your transferrin molecules. So they always go opposite to one another. And it makes sense. If I have more storage, it means I do not need transferrin to transfer or to bring back more of iron into my storage sites. Okay, for example, if the ferritin is decreased, if I have less storage, it means what happens? The body will be dumping more transferrin in order to catch as much as iron as they can and bring them to the storage sites, right? Hello? Hello? Are you guys getting that? Okay. So it means they both go opposite to one another. Okay, so the third thing which we'll be discussing is that the percent saturation of transferrin molecules. So, for example, if we have, let's suppose 10 molecules of transferrin, 1 2 3 4 5 6 7 8 9 10. Okay, so what do you think, how much molecules would be carrying that iron, because all of them cannot carry your iron? Hello? Okay, so only 3 of these molecules would be carrying iron, remember that. So the normal saturation for your transferrin is basically somehow 33% or 30%, right? You can take some, a little portion of it as well, right? Hello?
Yes.
Okay, so okay, what are some of the causes of iron deficiency? One we have discussed. Secondly, for example, if you have an infant and he's breastfed, so the breast do not have enough iron, right?
Right.
Okay, if he do not have enough iron, it means he's going to develop anemia, iron deficiency anemia, that is microcytic anemia. For example, if you have an adult, he has some peptic ulcer or menorrhagia. In peptic ulcer, he's losing the blood. It means again we are going to see iron deficiency anemia, right?
Yes.
Okay, hookworms. If person is having hookworms, simply the hookworms are going to drink their blood. You can think of, if you are they are losing their blood, it means what happens? You are going to see iron deficiency anemia again. Okay, so now okay, for example, okay, there is an interesting thing which you guys should know. So those patients who are having iron deficiency anemia, they also develop a condition that is known as pica. So what is pica?
They eat anything which is
Eating sand or soil.
Yes, so they would develop pica. they would be just chewing the, let's suppose you guys can
Sand.
simply say that they would be eating sand, they would be eating soil, and mostly they would be just try to chew ice. So simply you can think of that they are looking for the iron in different sources. You can simply think of like that, right? Why do they develop pica? You can simply think of they are looking for the iron in different things. They are looking for the iron in soil. They are looking in the, okay, so they can also develop pica. Okay, it's also important you guys must know. Okay, so now let's discuss. Okay, for example, if a person is having iron deficiency anemia, what happens to the level of ferritin, guys?
Decreased.
Decrease.
Okay, what happens to TIBC?
Increased.
Okay, what happens to the serum iron concentration?
It's
If
also
I have,
decreased.
yes, what
Decrease.
happens to percent saturation? If I am having less iron, it also
Decrease.
decreases. Perfect. Okay, so you are going to see microcytic hypochromic anemia. What do we mean by hypochromic?
Light in color.
Yes. So the color basically indicate that you still are having microcytic, but inside the RBC, the constituent which is basically your hemoglobin, it also decreases. So hypochromic, the color is basically given by hemoglobin. Simply you can think of. So both hemoglobin and size decreases. So microcytic, hypochromic, color less color anemia, right? So
So, doctor, I have a question. So, microcytic is related to deficiency in any three of them, like iron or porphyrin or like globin, right?
yes,
So, if we are deficient in any three of them, then it says we having like
yes.
microcytic.
If you are having deficiency in your iron, you are going to see microcytic anemia. If you are going to see certain deficiency in this protoporphyrin pathway, inlet toxicity, which we will be studying, again you are going to see microcytic anemia. If a person is having thalassemia, that is defect of your globin chains, again you are going to see microcytic anemia. Simple.
Okay.
Okay, so you don't you like don't confuse yourself with the other types. Like I've just made it simply. You can just simply think of. So, anemia of chronic disease. So, what happens in anemia of chronic disease? We have already discussed some of the idea. For example, if a person is having some chronic disease, in the chronic disease, your liver are going to produce certain substances which are basically known as acute phase reactants, right? Right?
Yes.
What are so these acute phase reactants? One of which is hepcidin, right?
Mm-hmm.
What would hepcidin do? Hepcidin would just tell that macrophages and your liver that store that iron. Don't release them into your blood. Don't release iron into your blood. Why? Because this chronic condition might be due to some bacterial infections, right? Hello?
Okay.
Right.
And this bacteria, for their growth, they need iron. They need iron for their growth. So what would hepcidin do? That please don't let your iron to come inside your blood, because I can have increased bacterial growth or increased bacterial survival, right? So
Right.
along with that, I am helping this chronic condition to subside, but along with that I am having another problem. What's that problem? Iron deficiency anemia, right? It can lead to microcytic anemia, right?
Right.
Okay, if it leads to microcytic anemia, okay, it can also suppress your erythropoietin EPO. Okay, so if it's leading to microcytic anemia, so then you are going to tell me what happens to ferritin stores?
Increase.
Increases because your hepcidin isn't letting ferritin to drop off iron into the blood. Okay, secondly, what happens to the total iron binding capacity? It all always
Decrease.
decreases.
In
They always go opposite to one another. What happens to the serum iron level?
Decrease.
decrease.
Decrease. Okay, what happens to the percent saturation?
Decrease.
Decreases. Okay, let me tell. Okay, what do you think? What will happen to the free erythrocyte protoporphyrin level? Increase. Perfect. It would increase. Like if I am not making the heme, because heme is made up of iron, it means it would increase. Okay, you're going to increase. Okay, so the last
Sir,
condition
pica, one query just in pica you say ferritin and TIBC both are decreased.
in pica, what did I say? In pica, I haven't said anything. I just said it's a psychological condition in which you are going to eat, which basically happens with iron deficiency anemia.
So the left finding is like this type ferritin decrease, TIBC increase, like iron deficiency anemia type.
Okay, if you have iron deficiency, so ferritin would decrease. If I'm not letting iron to come from outside, so it means ferritin are going to decrease, and as a result of that, transferrin would increase, or the total iron binding capacity would increase. But the anemia of chronic disease is very different than that case. It's a kind of chronic infection.
It's kind of adaptation
You
as well.
aren't losing your iron. You are only just sequestering them into the. Sorry. Hello.
In chronic disease, the body is adapting the things.
So body is, yes. What do you mean by body adapting things? Hello,
The
doctor.
TIBC is decreasing, fat is increasing, so it adapting.
Yes, it can adapt. Yes, you can, it's right. Your ferritin is increasing, TIBC decreases. So, okay, so the last condition for today, which we'll be discussing in the anemias. Okay, so tomorrow I'm planning to have a big session of 2 hours as well in order to cover all of these things. But for today, it would be our last topic, and I'll be just sharing those PPTs. Kindly revise that, right? So the last topic for today is okay, type of anemia, that is sideroblastic anemia. So what is sideroblast? Now we are going to know. So I already discussed that in protoporphyrin. How do protoporphyrin are made inside your red blood cell? First of all, what happens? Your succinyl, okay, your succinyl coenzyme A is going to be converted into anyone amino levulinic acid, right? Okay, and it would use a cofactor, that is cofactor B6. Along with that, they are going to use an enzyme, that is ALA synthase. Simply you can just remember of that they are synthesizing ALA, so I will be using ALA synthase, right? Hello. Okay, then what happens? You are going to see conversion of amino levulinic acid into proto porphobilinogen. Sorry, porphobilinogen. And the porphobilinogen is ultimately going to convert into protoporphyrin. Okay. So this step requires as enzyme, that is ALA dehydrogenase. And this step basically, for example, once the protoporphyrin is made, you are going to combine it with the heme as well, right? And going from this step, hello,
With iron in making heme,
sorry,
we are combining it with iron in making.
yes, we are combining it with iron, and then we are going to make heme. Okay, so this step basically require an enzyme, that is ferrochelatase. Ferrochelatase. What do you mean by chelation? You guys might have studied that you are taking some iron or some inorganic things, and we are just collecting them and just combining it with some organic parts. So it's basically known as chelation. So we are going to see ferrochelatase. So for example, if a person is having some lead toxicity, for example, lead toxicity can happen due to some exposure to some those who are working in battery making kind of industries, or in the past, basically some people use lead paints in their houses, and what do the children do? The children would just eat them. So what happens? They were just more prone to have lead toxicity. So lead toxicity can simply inhibit these two enzymes. If I'm inhibiting these two enzymes against what happens, there is problem with formation of protoporphyrin, right? If I have less protoporphyrin, I cannot make enough hemoglobin. If I cannot make enough hemoglobin, it means what happens? We'll be seeing microcytic anemia, right? Hello.
Yes.
So basically, this step, like where the heme and the protoporphyrin combines, it this basically happens in the mitochondria. Okay. If I am not letting this protoporphyrin to combine with the iron, so what would iron do? Iron would just come and it would just load their self, and it would just surround the mitochondria. The iron would surround the mitochondria in this case, because I have iron, but iron cannot be loaded into these structures because I have some deficiency with the enzymes, right? So it's going to form a ring around the mitochondria. You are going to see ring formation around mitochondria, or you are going to see this structure can be also, this is also known as ring sideroblast. You can see cedar for cedrin, hemocedrin for iron, simply you can think of. So you are going to see ring sideroblast, and this kind of anemia is basically also known as sideroblastic anemia, right? Okay. So this was all about the microcytic anemia. We'll be continuing our lecture for tomorrow. So today I'm going to share those slides. Kindly review those slides. And are you guys done with your this anemia portion of your world?
Not yet.
Why? You already have finished the anemia portion. We already have shared those tasks.
Not completed yet.
Okay, so kindly complete that. Guys, I am seeing that most of the people are feeling demotivated. Why are you guys feeling so demotivated? We are already done with half of our course.
Doctor, can you tell us when we will get the explanation for all the last assessment?